Hey there, it's Dr. Andrews here with another Aesthetic Angle podcast. And today we have one of our patients, Taylor, who has very graciously agreed to talk about her experience with our rapid recovery breast augmentation program. So Taylor's 29. She's 6 weeks out from her procedure. Just tell us a little bit about yourself, where you're from, and what you were thinking in terms of pursuing breast augmentation. You kind of have a little bit of a interesting history, right? Because you have some family members who had surgery. You have a family member who is a plastic surgeon, now retired. So talk a little bit about that, where you're from, all that stuff.
Yep. So I'm from the Quad Cities. My uncle is now a retired plastic surgeon. So, I mean, I grew up seeing, my mom with boobs, my aunt with boobs, and then my sister just got boobs as well. So it's very common for me to associate women with having breasts.
Exactly.
So, I mean, our family wasn't blessed with that gene.
Sure. Gotcha. Yep.
So I gave myself a year, and I was like, if I'm still thinking about the surgery, that means I clearly want them. So I went along with it. I asked my uncle, who, since he's now retired, I went along with, and I asked him who he thought would be the best, and he gave me your name.
And I love that. I contacted him and thanked him for that because that was a nice endorsement. So you are very fit. You work out a lot, it's hard to manufacture breasts.
Yes,
you know what I mean? You
definitely.
can get a narrow waist by
Yep.
exercising,
Yep.
right? You can do squats, and you can, make, your bottom look, more shapely. You can, tone your arms, but sometimes it's hard to improve other areas, and breasts are that it's one of those areas. Now, a lot of women think having breasts is part of being sexy and body image and that kind of thing. And I know you mentioned that you like the way you look now in clothes, right?
Absolutely.
That you fill things out.
Yeah.
Talk a little bit about that.
So prior to having boobs, I could go to the gym and I could change my waist, and I could make my legs fuller, and I could do all of that, but I would still put on tight clothes, and having a more muscular build, it was kind of boxy,
right?
So I would look at myself and I was like, I put all this work in, but I'm not looking how I feel confident. Sure.
So it was a little disproportion, you know what I mean? And not necessarily because you wanted to look like Dolly Parton or anything like that, but you just wanted to feel more feminine, right? Because you put in so much work with your diet, right? Because that's, like they say, 80% of it, right?
Exactly right.
So with your diet, and discipline with respect to that, and then exercising, but felt a little disproportionate, right?
Correct, yeah.
Now, there are no standards, right? Women come in all shapes and sizes, right? And so, but there are some women who feel like having breasts make them look more, you could say, attractive, and that's our Western aesthetic, and it's unfortunate that some people feel that if they don't have it, they don't feel sexy. But certainly in our society, having breasts and being able to fill out a shirt is seen as more attractive.
Yes.
So tell us about the experience. So you came in, we did the consult, we talked to you about all the things that we like to talk about with respect to breast augmentation. Number one, we like placing the implants below the muscle. Number two, we like using an inframammary incision. Number three, we like using silicone implants. And then the last thing is size. And that oftentimes becomes the most, I wouldn't say important, although those other things are important, but in terms of, what the patient needs to decide, right? Yeah. With respect to those four things, size is one of those things that we really have to, have some good systems to allow patients to inform them and give them some information about how to make that decision. It's a very personal decision. I've had situations where husbands are like, oh, I want you to go bigger. I've had situations where husbands say, I don't really care.
Yeah.
Right. And that's actually most. A lot of people be surprised. But for you, you and your mother came for the consult, and you guys kind of made that decision. So talk about that process.
Yeah, so I wanted to look very natural, and I did get that result. I came in with the mindset that I wanted a C cup, a small C cup, any
Yep.
sort of C cup, coming from not ever wearing a bra because I
Yep.
didn't really need to. I just figured that would be a good size for my body shape. I am kind of wider
Mm-hmm.
on the top side, so I probably could have pushed a bigger
How tall
implant.
are you, by the way?
5'5" ish.
5'5". Okay.
Yeah.
Yep.
Yep. So we did in the simulation we did go a little bit bigger.
Yep.
But I did decide to go for the 305.
Yep.
Just because I was like, well, there's not that much difference, so I might
Yeah.
as well just go with the smaller size. And
Sure.
going from what I had to
Yep.
what I have now,
Yep.
I think it's a perfect
Yeah.
size
Yeah.
for my
Yeah.
body.
Yep. And so for our practice, that 300 range is a sweet spot for us.
Mm-hmm.
Certainly if you were in Miami or in Vegas,
Yeah.
New York, LA, their average size is probably a little bit larger.
Mm-hmm.
But what we typically say for someone who's about 5'4", 5'5", average height of a woman's about that. We say in the 300 range, you'll look natural. In the 400 range, you're in the D cup, right?
Mm-hmm.
And starting to look a little bit, more fake with the round upper pole. 500, you're in the double D, really, depending on where your breast is on your chest. I mean, you're really starting to push things there and get that real round upper pole, even out of a garment,
Yeah.
right? So even you with 300, if you wore a push-up bra, you could get some of that upper pole,
Yeah.
right? And we do
Definitely.
have patients that do that, when they wear a push-up bra. After about a year, we let patients wear a push-up bra. If they wear a push-up bra, they can get that more voluptuous look, and we call that the social breast,
The social breast.
the breast that you show the world,
Yep,
right?
okay.
But if you want that push-up look out of a bra,
Mm-hmm.
you really need a much larger implant. So you're talking about 500, 600 cc's. And
Yes.
there are some women who kind of want that. So when you came in, I know we used our mentor sizing system. And so you put on a little bit larger bra that we have, and then you use the silicone sizers, and then we did the simulation. So interesting thing I like to talk to patients about is when we did that simulation and then you looked at your final results. Tell me about that. Do you think that they kind of correlated?
Yes, definitely. I was actually shocked when I looked at my after pictures and then back to the simulation that I took a screenshot of, and I was like, they actually look exactly how you showed me that they would look. So I was very shocked and happy by that, because when I did see the simulation, I was like, perfect. This is what I want.
Got it.
So that's exactly what I got.
And that's what we found. We found that doing simulations really gives patients a lot of information. And so there are a couple of companies that provide those services for us. There's one called New Look Now that we use. We use Chrysalix for you, and that's one that we actually have, and we can do those simulations right here in the office. New Look Now is a service that it's in California, and depending on the time of the day, we don't get those simulations back, but it's remarkable. I mean, they can simulate hair restoration, facelift, eyelid tucks or eyelid lifts, blepharoplasty, breast augmentation, tummy tucks, BBL, thigh liposuction, brachioplasty. I mean, they can simulate everything, and so we're super happy that we have that system. But it really helps us give patients an idea of what they will look like after the procedure. So let's just talk about the procedure. So you came in. Did we do you in the morning?
It was 11:30.
11:30. So okay, so it was a second case. And so the whole episode of care, probably you came in, probably was about 30, 45 minutes in the pre-op area. The procedure probably took about an hour, and then you were gone usually about 45 minutes after. Tell me what you did that night and the next day, and were you surprised by the experience? Because a lot of people, they'll read online, oh, it really hurts. You put them under the muscle, you might get muscle spasms and all those things. We did do what we call the rapid recovery process, where we did the block. Tell us about your experience with the block.
Yeah, so I was actually most nervous, about how I would wake up from anesthesia, because I never had surgery before. So I was very concerned about how I would react.
Yeah.
I wasn't too concerned about pain. But I actually woke up and I felt great. It especially prior to the surgery, you know, the anesthesiologist came in and he talked to me. He told me exactly what he was going to do with the block, and that made me feel very comfortable.
Yep.
I really appreciated that. So that was very nice.
You know,
And
one
then,
nice thing is that those anesthesiologists worked with your uncle for years
Yep,
and years.
yep,
So
and
that
that's what
that
he had
actually
said.
was nice, you know, yeah. So and they're, you know, board certified anesthesiologists who have a lot of experience with plastic surgery patients. So I think that makes a difference as well.
Yeah.
Yeah.
Yeah. So that was very nice. I woke up feeling great, and I had thought, since, you know, I live in the Quad Cities, it's about an hour drive, and I
Yep.
stayed with my parents, so that's an additional 30 minutes. So it was an hour and a half drive, and I was like, oh, I'm not sure how I'm going to feel on the drive
Yeah.
home. And I was like, well, maybe I'll sleep. And I was wide awake, talking, like coherent the whole time. So I was very happy about that as well. I went home that night. We ate supper. I just kind of lounged on the couch for a little bit. And the
Yep.
next morning I woke up feeling great. So my mom and I went for a mile walk, and it was amazing.
Love that.
Yeah.
Love that. So one of the things that the block allows us to do is actually give less anesthesia, right? And so once we get going doing the surgery, we have to create the submuscular pocket, right? So as we're doing that, although the patient's asleep, we're still stimulating them. So we still can see heart rate go up, blood pressure go up. We can see an increased need for anesthetic. The problem with anesthesia is it lingers postoperatively. So one of the things that the block allows us to do, in addition to treating pain after the procedure, is give less anesthetic during the procedure. So that probably went a long way with respect to you feeling better after the procedure and not having that nausea that a lot of women have after having gas anesthetic. And then that night being fairly lucid, and then the next day not feeling, you know, kind of tuckered out, you know, and being able to go for a walk. So in terms of that post-op period, I know you said you woke up pretty lucid. You were pretty lucid that night, didn't have that kind of post-anesthesia effect. In terms of the pain that you had with respect to that block, did you take any of the narcotic pills? Because we typically give 15 narcotic pills, and we also give Valium because some people get spasms. Did you take any narcotic pills?
I did not. I took some ibuprofen just to stay ahead of if I were to have pain.
Yep.
But no pills.
No narcotic. That's nice. Did you take any of the Valium?
I did take one pill
Yep.
Before going to bed.
Yep.
That
That
night
night.
of.
Yep.
Just to make myself sleep, you know.
Absolutely, yeah, because
Just
it is an
to be
anxiolytic
comfortable.
and it is a sedative, and it's a medication that we use to help people go to sleep. So that's a nice thing. That's not everyone's experience, but I'd say probably 60 to 70% of the patients who have the blocks take no narcotic. We do see patients taking some of the Valium because sometimes you get the spasms, but taking no narcotic, we're really excited about. And if a patient does take narcotic, it's usually just 1 to 2, and it's in that first 24, 48 hour period. So that block has really changed the game, not just with breast surgery, but also with abdominal procedures. We've had patients who've had circumferential liposuction, tummy tucks, augmentation mastopexy, and have taken like 2 and 3 narcotics. So it's really been a game changer, and we're really indebted to the Western Illinois Anesthesia Group, the group that's worked with your uncle for years, for stepping up and training and learning the block, because not all anesthesiologists understand ultrasound anatomy, and that's the key. You have to know ultrasound anatomy, and sometimes it requires that you do some courses, you know, after you train. So we're really indebted to that group as well. So that's a nice thing. So you had the procedure. We saw you in a week. We had that tape on you. You came back in 2 weeks. We took the tape off. You told me at about 3 weeks you were able to start doing some leg exercises, and now at 6 weeks you're able to do more with your pec. Talk about in terms of, you know, what your restrictions were, what you felt like you could do and couldn't do. When did you go back to work, by the way?
So I do work from home.
Yep.
So that was easier for me.
Yeah.
But that Monday I was back to work. I didn't take any. I took that Friday off right after.
Right.
But then I was back
Great.
to work.
And then in terms of your activity, you say you were able to walk the next day, but then when did you get back to the gym and that kind of thing?
Yep. So like you said, about 3 weeks I went back, and I was just doing bodybuilding, lower lower half.
Yep.
And then about 4 weeks back, I went back to doing just bicep curls, triceps, that sort of stuff, nothing
Yep.
above my head. And now 6 weeks in, this past week, starting on Monday, I started doing push-ups. I went from my knees, so I did them easier, I guess you
Yep.
could say, but slower, and I controlled myself. And I could feel the implants, so it did feel different, but there was no pain. So
Yep,
I would
yep.
say I'm back to normal now.
Now, what about your sensation? Have you had any issues with sensation? Did you have decreased sensation after the procedure on the skin of your breasts, and after? Have you noticed any changes?
I was a little numb on the sides.
Yep.
But other than that, no
No,
real
no change in your
Yeah.
sensation. Yeah.
Yeah.
So I know there are a lot of patients who are concerned about that, both with breast augmentation and breast reduction, and some people and breast lifts. And some people say that I just had a woman in the office last week who was very concerned about her nipple sensation, and said that she, I have some women that say they won't have the procedure if that changes, and sometimes that's a little bit unpredictable. And the same thing with lactation. Are you planning to breastfeed in
No.
the future? Okay.
No kids for me.
Okay. Well, that's a concern for some women as well. And so what we tell patients with respect to sensation is here. Sometimes it's hypersensitive. That typically goes away. Sometimes it dips down. And if it's not back after 18 months, we say probably not coming back. And then in terms of lactation, what we say is you should be able to make milk. Can't guarantee that you could fully support your baby, but you should, make that really important milk, the colostrum, right after you give birth. So that's very important for the baby. It has immunoglobulins and is very important, but that can be affected. So I think we're going to wrap up. I, again, really appreciate that you, allowed us to interview you and talk about your experience. What would you say to any woman across the United States, maybe around the world, if somebody's watching this, about making this decision? I know you had some experiences with and you say you didn't really feel pressured to do it by your
Correct,
family,
yeah.
but what would you say someone thinking about doing it? I'm sure you did some research online and that kind of thing. You talked to your family. What would you say about someone interested in doing a breast augmentation?
I think what really helped me was giving myself that time frame to not make an impulse decision, because it is a change to your body.
Yep.
But really, it's all up here, like the way you feel about yourself.
Right.
So work on that first, and then work on your physical appearance.
Good for you.
So.
Yeah, no, that's very well said. So thanks for tuning in. We're going to have more podcasts coming, hopefully more patient interviews and informational podcasts about various procedures that we do. We also would like to thank the Recenter for sponsoring us and allowing us to use their space to do the podcast. So stay tuned for more episodes of The Aesthetic Angle. Thanks.